On December 31st, 2019, a novel coronavirus was first detected. This was the start of the COVID-19 pandemic. This event changed the lives of everyone, a change intensely felt by our healthcare workers and professionals. Join me, Ryan Funk, as we sit down with Manitoba-based frontline workers, immunization specialists, doctors, and nurses with diverse backgrounds to share their stories, experiences, and contributions during the pandemic in Canada. So, I'm here with Dr. Denise Koh. How are you doing today?
I'm doing really good, thank you.
For our listeners, can you just give them a brief description of what you do?
Sure. I'm a public health specialist, and I have two roles with the provincial government. The first one being the Chief Occupational Medical Officer, which is with Workplace Safety and Health. And then the other role is as Medical Officer of Health with Population and Public Health. And I'm also a psychotherapist, hypnotherapist, and life coach.
The current position that you're in, was that something that you were in before COVID?
Yep, both positions actually.
I guess what were some of the things you were doing pre-COVID?
Basically, as a medical officer of health, I was in emergency preparedness and disaster management. And a lot of that was related to, anything in terms of planning for emergencies and disasters. For instance, extreme cold, extreme heat, the wildland fires, things like that. All sorts of different issues that...
So it really encompasses a lot of stuff.
Yeah, obviously not COVID because that wasn't a thing then. But and then with my occupational role as the COMO, which is Chief Occupational Medical Officer, I was doing things related to workplaces and basically ensuring that the workers and workplaces are as safe and healthy as they can be. So I did a lot of work with medical surveillance, which is when we're testing workers to see whether they're overexposed to different hazards or, chemical substances and that kind of thing. So I do sort of everything in both of those roles.
Wow.
Yeah.
We were doing a ton of stuff before COVID, but I'm guessing with once COVID hit, things kind of hit the fan in terms of how busy your schedule got.
Oh yeah, it was pretty crazy. Yeah, essentially, my role within the government was kind of a mashup between the two jobs. So pretty much anything that was workplace related, that was also related to COVID, which was kind of everything, came across my desk, or I was involved with, or I was leading. Writing guidelines, creating tools for workplaces, answering questions related to anything in terms of employers calling in questions from them. I was the public health advisor for food processing and the food processing sector. So I did a lot of work there, and a lot of it was related to, testing and treatment and, planning for vaccines. And then I also worked a lot with temporary foreign workers as well. Work camps, also if there were clusters or outbreaks occurring in these workplaces, I was involved with that as well. It really, anything and everything.
Busy.
Yeah, it was nuts. It was nuts, but it was also pretty cool, interesting stuff.
Oh, and probably very fulfilling because the work that you're doing is directly affecting people's lives.
That was one of the things that really... I really, a positive thing, I guess, that I got out of that experience was really being able to sort of see closer to real time the effects of the work that I was doing. And sometimes, public health, we implement actions or public health measures of some sort, and we don't always see the benefits or immediate benefits from that. That part's kind of missing, which is it's par for the course for public health. But the pandemic was, different in that it was very much real time. That part I really actually liked.
In those leadership positions, what sort of conversations were happening as we're just inevitably waiting for that first case to hit us here in Manitoba?
Well, when I look back at the different waves and whatnot, I think with the first one, we did quite well with it in terms of the measures that we put in place. And then, the numbers that we were seeing, it wasn't as bad. But then things quickly, got...
As things do.
Got really, really tough, not so. Lots of numbers and whatnot. It was a tough time. So I think the conversations changed a bit. So I think we were probably in the very beginning, we were putting a lot of things in place and probably feeling pretty okay about those things. We were relatively prepared. I think once it got down to it, and the longer that the pandemic went, the more it was like a grinding on us, basically, because we were doing that for such a long period of time, and people were getting very much burnt out.
And I mean, for the everyday, citizen, we were, everyone was getting burnt out during that time. It was only, we've just hit that kind of 3-year mark when things were happening. But it sure feels a heck of a lot longer than that, kind of looking back. But also quick at the same time in a strange way. Yeah. But sometimes, we forget what, the toll it takes on people in leadership positions, because we often forget, oh yes, they're also people. Yeah.
Yeah, it really negatively affected, I think, a lot of people who are in leadership positions or, also in healthcare.
Well, people are relying on you and counting on you to make the right decision, right? So that's a lot of pressure.
Yeah, it's kind of like you have your job to do, but then you also have an audience that's critiquing you as you're doing it, every single piece of it, right? So I think that part was very difficult, and we had lots of, oppositional type forces or resistance, or people who just really didn't trust the work that we were doing and what we were putting forward, and so there's a level of frustration with that too, because as a physician, we really want the best for people. Of course, we don't want to see people.
Of course, it's never
suffer or
when people are sick or there's loss of life. It's never a good thing. Those are people's friends. Those are people's families. Yeah. And anytime something negatively happens, it's, it takes a toll on all of us in society.
Yeah, and I mean, that was kind of the thing too. I think just kind of experiencing it as a regular person, I have my family, I have my concerns, remote work, and the kids were not going to school, all of those pieces, but then also being at the level that I was at, where I also could see the inner workings of how decisions were being made, and the information that was coming and the different challenges. It was a time of a lot of growth, I guess you could say.
Yeah.
I mean, it was a lot to take in all at once.
How frustrating was it that every person who read a headline somewhere thought they were an expert at that point? There was a lot of misinformation that was going around during COVID, both before and after the vaccine. I guess just in a leadership position, what is that experience like when you have a subsect of the population that's like, no, you're completely wrong. This is what actually is going on.
It's frustrating on different levels too, because, especially, with my friends and colleagues who, are physicians and healthcare providers, where they're seeing it real time and they're getting burnt out at the same time. Plus, they were also facing increased risk from the people that were, anti-vaxxers, anti-maskers, et cetera, conspiracy theorists, all of that piece of it. So that part's frustrating. And then, of course, there's also people who were quite mean, right? Abusive, either sometimes physically abusive or, verbally. There were, I think, some times when I think we were scared. I was fearful for some of my colleagues who were inspectors, public health inspectors, anyone who was in enforcement. I was really praying that they'd be okay.
Yeah, I've heard some stories.
Yeah, and so, I mean, that part was extremely frustrating. And I mean, at the time, I think for me, I was really trying to figure out ways to get that trust back from the public, if there was a way to do that. I mean, at a certain level, I think there were people who just, it doesn't matter what you say, they will believe what they're going to believe. So in a way, there's no point in convincing them or trying to convince them. It then just becomes more of harm reduction and just managing the damage, minimizing the damage. It's easy to say that now, but I mean, at the time it was, very upsetting. And a lot of my colleagues were, really burnt out and very, very, very stressed and very much struggling because of all of that too. So
you have the decisions you have to make that affect people, and then you have people like the everyday person that's critiquing you just because, people critique leadership. And then you have this other group that's being incredibly aggressive. So, of course, that's going to take both a physical and mental toll on someone. And
I saw that a lot, in my colleagues. A lot of people were, tired and stressed, and it was difficult. When I look back for me, I think I had a lot of adrenaline going for a long period of time. So, it's almost after the fact.
Let's forget about your needs sometimes when you're just on that, go mentality.
Yeah, there were lots of days when I worked, extremely hard, and I kept going, and I had to get, my family had to say, okay, you need to stop, you need to go to bed, or you need to eat something, you need to go to the bathroom, like things like that. At the same time, I'm very passionate about the work, so it was hard for me to sometimes shut that off and just be, me and a mom, and
just to be a person.
Just to be a person, exactly. So it was difficult, but
and I think that's incredibly relatable. I can't even count how many times I've been completely engrossed in something, and then you're like, did I eat anything today? Oh, whoopsie, did I drink any water? Well, I better drink some right now.
Sometimes
I'll do it right now.
Yes, let's hydrate.
Hydration. It's incredibly important.
Yeah, it was incredibly difficult in terms of probably physically. That was pretty tough. And then there's the mental strain too. Like, it was very satisfying to be able to make decisions and do my work and then see real time the positive effects of that. So that was something that I wasn't used to seeing for a while, or not seeing as much of it. So that part was actually probably reinforcing me to be a little obsessed with the work. But, the difficulties and the strain related to the misinformation, the fact that there were people there that, because of their not understanding, the research and the evidence that was out there, or else not trusting us, it wasn't just something that we could sort of see on the outside and looking and going, oh, okay, that's okay. Because we're also seeing it in terms of real time, how those people are going to be increasing the risk to somebody that I care about. That's, not wanting to go home. Yeah. They don't want to bring it home to their family, right?
Well, that's always the struggle, right?
When
trying to not bring work home, but inevitably sometimes it bleeds over, and then you get friction at home too, which is never good.
Yeah, I mean, it was like so many different things. I mean, there was so many sort of terrible things that I sort of saw in terms of, human nature and that kind of thing. But then I also saw a lot of people who were really just wanting to do the best that they could in that work. Doctors who were completely burnt out but would go to work anyway because there was no other option, and they knew that if they didn't go, then there'd be no one. So I know that there was a lot of really tough decisions that were being made, that they had to face in terms of, patient care and that kind of thing. There were parts of it that was really, it's inspiring to see, but it was also like heartbreaking to
you could really see the two sides of humanity in moments. The incredibly ugly, but also the triumphant, the heroic people going to work. Everyone, like, whatever the job was, if you were working during the pandemic, you were making a difference. Whether you are just a delivery driver or someone working at a gas station, you're making a difference. And without you, we wouldn't be here right now.
You could also look at it that the people who weren't working were also making a difference. Actively infecting other people, or hopefully they weren't. So everyone was doing their parts.
Now that we're on the other side, there's a lot we can learn from this whole situation that we went through. What were some of the things that you felt were like, this was a triumph in terms of getting through this situation? And what were some areas that you saw that maybe were shortfalls and that we can improve on moving forward?
I think in terms of things that we did well, I kind of mentioned it earlier, it was, people that were going the extra mile, really just working earnestly, working really hard because of something that they believed in and they really cared about Manitobans. And so that part, I think, was something we did well on. I know that my team worked extremely well with, other stakeholders that we were dealing with. So employers, workers, industry-based safety programs, different regulatory bodies, the feds, all of that. We worked really well together, and I think that really showed in the work that we were able to accomplish in that short period of time, or relatively short period of time. And then also, I did some work with the Newcomer Vaccine Advisory Working Group. So there was a lot of really great work that came out of there. Another positive there was that, we worked really hard to get the vaccine clinics in places where people who are racialized could go more easily, because there are issues generally with access to healthcare.
Well, every time there's a crisis situation, the most marginalized within society are the ones that take the brunt of it.
We did actually see a lot of gains from that in terms of the vaccine uptake from all of that work. So that was something that I think we generally did well on. In terms of things that could have been improved, there were a number of things. I guess one of them was really the kinds of information that we gathered that really could have been improved, particularly when it came to workplaces and workers, which is obviously my area. If you collect certain pieces of data, then your policy flows from that, because then you have the evidence to be able to act on it. And if you're not measuring something, how do you act on it? Well, So, in that way, I think that could have been something that could have, we could have done better and maybe earlier. In terms of the vaccine criteria, something I really pushed for was moving away from just looking at age as the reason for choosing eligibility, and looking at different types of risk, particularly in the workplace, because that's my area. Really looking at other different pieces of criteria for determining that, which is something that we didn't do, and which our statistics really show that could have made a big difference. Those are two big areas. I think in terms of our communications amongst ourselves as an organization, that could have been improved, so that there was a lot of duplication of efforts. People were doing different things. We didn't always know what somebody else was doing, and it could have been related to the same type of work. Those pieces of it, that could have been improved. And then also the communication with the community. I think that was another big one. If we had that level of trust with the community, hopefully, ideally, we wouldn't have had that much difficulty with misinformation that was going on. And then I guess another thing, too, was when we were getting really overwhelmed in terms of our resources in Omicron, suddenly removing all the controls without maybe having a lot of explanation as to what were the pieces that contributed to those decisions. I think that would have helped in terms of the trust levels, with different organizations and Manitobans overall. So I think that could have been done a little different. There was a lot of work that went into workplaces. A lot of employers put in a lot of measures, and then suddenly it was like, oh, we don't need it anymore. Well, you actually still do. All of it contributes to decreasing that risk in that workplace. That was something that I really had pushed for.
It's a situation, and now that we're on the other side, we can take what went well.
Exactly.
We can take what didn't go well. We can build from there. And there's so much information that we can take from the world as well. How they reacted. What was their closures? When did people open? How long did they wait? And if we can process that information, God forbid something like this happens again within our lifetime, maybe we can be more prepared and more united getting through it.
Especially the work that I did with the food processing sector. We were able to not have the kinds of outbreaks that were shutting down other jurisdictions in Canada and in the world in terms of food processing. So there was a huge outbreaks that were occurring, and we didn't get those. I know we did a lot of things that was really great work, and really did make an impact, and really prevented illness and death and that kind of thing too. So that was, there were lots of wins there as well.
Thank you so much, Denise, for taking the time to share your perspective with us. I think it is integral to kind of get the perspectives of people of all backgrounds in these conversations.
Well, thanks very much for having me. It was a pleasure.
This project is funded by the Government of Canada through Canadian Heritage.